The Center for Community Health and Prevention congratulates Dr. Amali Epa-Llop for being the staff recipient of the Dr. David Satcher Award for Community Health Improvement.
It means a lot to receive the Dr. David Satcher Community Health Improvement Award because of the work that we've been doing in the community. Specifically, I work with men and women who are underserved, underrepresented, and sometimes men and women who've been released from incarceration and who doesn't have access to healthcare or other social services. So it actually means a lot because that means the work that we do is being seen, has been noticed. I'd like to thank my team, especially Dr. Morris, who has been a really great mentor, not just a superior. She has been really helpful in my journey because I started this job without much experience in behavioral health. My background is in bench research. I mean, I have a PhD in bench research, so I learned a lot as I go, and she was very helpful. So as my team, we have 3 community health workers in our team. They were very helpful in my learning curve, made it easier. So I would like to thank them as well. I was always interested in doing good to the world, to our fellow people. It's important because the people that I work with, they're usually way overlooked because of their either criminal history or whatever the social structure, the underserved population is. They're always the last to be seen, to be heard. So I am actually, at the end of the day, I helped one person is what I take from my work. So I work as a senior human subject research coordinator with the Women's Initiative Supporting Health at University of Rochester. My work is primarily involved with clinical research. However, we also work with our community partners in some ways similar to a consultant, giving them the expertise in research or project management or data management, stuff like that. Whenever a community partners who are interested in working with us, but they don't have the expertise, I help them getting access to material or providing them training or building databases and all the training such as that as well. Definitely a team effort because we all bring different things to the table, and without that mix, it wouldn't work. So it's definitely a team effort. This one project that we recently did, we worked with a couple of community-based organizations. We worked with specifically Exercise Express. Karen Rogers, she was really helpful. She was always enthusiastic about the trainings that she had to do. She was very enthusiastic about and sort of set the pace for her team about when we talked about IRB training or city training. She was always enthusiastic. We had a screening tool that sort of based on social determinants of health, and based on that screening tool, it was kind of this project. Couple of CBOs came together in partnership with URMC, and we were the sort of consultant for the data management part. That was my part. And then Dr. Diane Morse, she was the primary care provider. So for example, if any of the CBOs would do an intake, and if they don't have a primary care provider, the idea was that Dr. Morse would act as the primary care provider. And then we also had 3 CHWs, community health workers, working with us. They would link them if they had any social needs. They would link them for social needs and other whatever the services that they needed. When we do a project, we always think about a project in our academic view, but that's very different for the community. So there's a little bit of hand holding that we have to do. A very good partner would be someone who would, be really enthusiastic about the whole process and willing to learn. And other community partners that I would like to mention are the YWCA, the Monroe County Jail and the Sheriff's Office, Common Ground Health, JPC, Center for Employment Opportunities, Coffee Connection, Human Trafficking Court, Probation, Parole. These are our vital partners. Like, there are so many other partners that we work with that I haven't mentioned. I work with men and women who have been recently released who have substance use disorders. And the problems that we see right now is, there's a disconnect between them getting released and then getting integrated back into the society. In my perfect world, I would hope that that step will be easier and there will be less stigma and discrimination for the people who need help, especially social health. I mean, primary care health or mental health or social health that they need will be easier. That's where I'm hoping my work would be more helpful.